livery. Upper girdle, two bones, clavicle and scapula. Scapula, the same name in Latin, scapula. This is flat triangle bone. It placed for me like this. Because of flat, it has three angles. Angulus superior, angulus inferior, and this is lateral, so biggest is lateral. And three borders, margo medialis, margo lateralis, margo superior. On the upper border, we have a notch, incisura scapulae. This surface looks to the ribs, to the rib cage, so facies castalis. And here we have pit, fossa. Fossa like under the scapula. Fossa subscapularis. This is dorsal surface, facies dorsalis. On dorsal surface we have spine, spina scapulae. Spine divided surface on two pits, below and above. So fossa infraspinata, fossa supraspinata. Spine continue to the process. This is acromion. And one more process here. This is coracoid process. Processus coracoidus. Here we have glenoid cavity for attached to the humerus. Very special name for articular surface. Facies glenoidalis. Behind is neck. Above and below two little tubercles. Tuberculum supraglenoidale, tuberculum infraglenoidale. This is clavicle. Very easy, you should know only. This is the body, corpus claviculae, and two ends, end in Latin extremitas. This looks to the sternum, extremitas sternalis. This to the acromion, extremitas acromialis. And on the lower surface, close to the acromion, we have tubercle, tuberculum conoideum, conoid tubercle, and line, linea trapezoidea. This is humerus. Humerus is long tubular bone. For all tubular bones, you should know this is body, corpus, other name is diaphysis. And this end is epiphysis. Between them is growing part for growing, metaphysis. After 25 years, all bones stop growing and cartilage turns to the bone. What it means epiphysis? Epiphysis, this is end of bone, and epiphysis means for attach to the another bone. So epiphysis for other bone. Not only epiphysis, also bone has apophysis. Apophysis for ligaments and muscle. So tubercles for ligaments and muscles. So you can say this is corpus humeri, and this is close to the body, proximal epiphysis. This is distal epiphysis, or you can say like end, upper end extremitas superior, lower end extremitas inferior. So, explanation. Head of humerus, caput humeri. Behind is neck, collum anatomicum, because this is anatomical neck. Because here we have surgical neck, collum chirurgicum. This is most fracture part of humerus. So this is epiphysis. Now apophysis. Apophysis, we have two tubercles. One is greater, one is lesser. Difference for humerus, greater usually major. Here is majus. Lesser usually minor. Here is minus. So tuberculum majus, tuberculum minus. After tubercle we have two crests. Crista tuberculi majoris, crista tuberculi minoris. And between them is groove, sulcus intertubercularis. One half of humerus is cylindrical, one half is trihedral. Trihedral means triangle, three side. It means one border in front, margo anterior, margo medialis, margo lateralis, and side. This side looks in front and medially. Facies anteromedialis, facies anterolateralis, and one behind, facies posterior. In the middle position, we have tuberosity for muscle. Muscle is deltoid muscle, musculus deltoidus. So here is tuberositas deltoidea. Behind, downward and in spiral heading, we have groove for radial nerve, sulcus nervi radialis. Lower end, for bone, we have this structure. This is condyle, condylus humeri. So this is distal epiphysis. Condylus humeri consists of trochlear, trochlea humeri, and little head, capitulum humeri. Caput humeri, capitulum humeri. So this is for bone. And for ligaments and muscles, we have epicondyle, condyle, epicondyle, epicondylus medialis, epicondylus lateralis. Behind medial, we have groove for ulnar nerve, sulcus nervi ulnaris. This is medially. So humerus, medial side, behind nerve. If you hit, you feel pain. Do you know it? So, what else? Above trochlea, we have pit, fossa coronoidea. Above capitulum, we have pit, fossa radialis. And behind, we have pit for olecranon, from other bone, fossa olecrani. Next, on the forearm, we have two bones. It's here. So, this bone is medially, this radius lateralis. So, this is ulna, in Latin ulna. Ulna, long tubular bone. So, again, diaphysis, epiphysis, between metaphysis. Proximal epiphysis consists of two processes. One is processus coronoidus. So, for coronoid process we have pit, fossa cranida. This is olecranon. So we have fossa olecrani behind. Between them, between two processes, we have notch, incisura trochlearis, because here we have trochlea. On the process, we have notch for radius, incisura radialis. Below process, we have tuberosity, tuberositas ulnaris. Body is trihedral. This border looks to the other bone, margo interosseus. This border in front, this border behind. And surfaces, facies anterior, facies posterior, facies medialis. Lower part named caput ulnae, head of ulna. On the head, we have this articular surface, this round articular surface, circumferentia articularis ulnae. And here we have styloid process of ulna, processus styloidus ulnae. Radius. On the radius, ulna below has head, radius above has head. Long tubular bone, diaphysis, epiphysis, epiphysis. Upper part named head of radius. On the head of radius we have articular circular surface, circumferentia articularis radii, attached to the incisura radii. On the head we have fovea articularis capitis radii for the capitulum humeri. Below neck and tuberosity, tuberositas radii. Then three border, three surfaces, this lateral. lower part. Below we have notch for ulna, so incisura ulnaris, because we have circumferencia stuck here. This is styloid process, processus styloidus radi. So we have two styloid processes. Processus styloidus ulnae, processus styloidus radialis. And this articular surface for next part. Next part is carpus. So facies articularis carpalis. So on the hand we have carpus, this part, 8 bones. Then we have metacarpus, this part, 5 bones. And then we have fingers. So carpus is 2 rows of bones, 8 bones together. You should know only names. Os scaphoidum. This notch looks like moon. Os lunatum. Os triquetrum. Os pisiforme. Pisiforme is here. Then os trapezium. Os trapezoidum. This bone with little head, os capitatum. And here is little hook, os hamatum. Then we have metacarpus. Metacarpus, 5 bones, and the same with the fingers you should know only. It has base, body, and head. For fingers, difference is 4 finger have 3 bones, only thumb has 2 bones. This is thumb, 2 bones. That's all.